Welcome, everyone, and thank you so much for joining us today at the 2020 virtual Fairfax County Public Schools Mental Health and Wellness Conference and Inova Act on Addiction Summit. This webinar series would not be possible without the generous support of Joan and Russell Hipp. Before I introduce our speaker, here are a few housekeeping notes. All participant lines have been muted and everyone's video has been turned off. We will be taking questions via the Q&A feature and they can be submitted at any time. We will do our best to get to as many questions as we can. Our speaker today is Kate Appleman, Senior Clinical Director of Men's Treatment Services at Caron Treatment Centers. Since 2005, Kate has been a clinician at Caron, working with adult professional and relapse populations. Since 2013, Kate has been active in program development, supporting the development of evidence-based clinical programming for executives, healthcare professionals, attorneys, and opioid addiction. Take it away, Kate.
Hear me?
We can hear you.
Okay, perfect. Start my video here. Welcome, everyone. Thank you so much for joining us today. I'm incredibly grateful to be a part of something so important as we look at where we stand in our country and our nation. We know so many things related to the opioid epidemic and where we are with alcoholism. And when you really look at throwing COVID on top of all of that, there's a lot that's happening in our country and for many of us right under our own roof. So I'm really grateful to be a part of this today. And as we get started, I actually want to start with a poll. If we can flip to the next screen. And my question is, I'm really curious to see who is on with us today. So if you could just take a moment and identify whether or not you see yourself as a healthcare worker. Are you someone who works in a school setting? Are you on here as a parent? Is your background something else? I'm just curious to see who's with us today, if you could take a moment to do that. We'll just give it one more minute. All right, so it looks like we have a few healthcare workers, a lot more school workers, some parents on here, and some others that hopefully there's some information in here that we capture that is important to you. So as we go through here, I'm gonna tell a couple of stories. I've had the opportunity to work in inpatient treatment. I also, just for full disclosure, when I think about the impacts that COVID has on families and children, my kids are 17, 10, and 1. I probably need my own support group at this point. But, you know, I think part of what's really important in the midst of COVID is to be able to share stories so that we can acknowledge that we're not all alone, that there are people who can relate to our experiences in one way or another. So if you forward to the next slide, as we look at some of the objectives, one of the things that I want to talk about is, as we look at the impact of COVID, A Tale of Two Cities is actually one of my favorite books of all time. And this quote from A Tale of Two Cities actually speaks to where we are very nicely. And I'm just going to take a moment to read it for those of you who have not heard it, and for those of you, it may be a review. It was the best of times. It was the worst of times. It was the age of wisdom. It was the age of foolishness. It was the epoch of belief. It was the epoch of incredulity. It was the season of light. It was the season of darkness. It was the spring of hope. And it was the winter of despair. I saw something not too long ago on social media that really talked about the fact that we're all in the same storm, just in a different boat. And that very much felt true for me when I had read it, and really looking at the experiences of some of the patients that come in here and some personal experiences, that feels very true. If we go to the next slide, please. Uncharted waters, as we look at COVID-19, the reality is change is one of the most stressful things that any of us will go through. And change, just that word feels like an understatement by far as it relates to everything that has been happening with COVID, whether it is preparing to fully work from home, if it's being a part of the 20 million people that are currently on unemployment as a result of losing jobs, if it is children trying to figure out how to be homeschooled, when to wear masks, when not to wear masks, how much time to spend in your household, what happens with your bills. Change is one of the most stressful things that we will ever go through. And really, when we look at the stress response that's activated as a result of some of the fundamental elements that make us human, we really look at the fact that for many people, in the midst of this, safety and shelter and food and the ability to care for our young, everything that makes us mammals has really been challenged in our current times. And while we know more today about what COVID is and what it isn't, the future still seems very uncertain. And if you go to the next slide, the truth is, none of us actually know what we're doing. Nobody has been through a pandemic before. And Brene Brown, being one of my favorite authors of all time, she really talks about the importance of looking at shame and vulnerability. And this quote, being new at something is the epitome of vulnerability. If we acknowledge that, we'll acknowledge the fact that for many of us, we're in a position where we're vulnerable because we're in times that we don't know what we're doing. And those who pretend to know are doing just that, pretending. This is new for many of us. So when I think about mindfulness and the importance of a beginner's mind, there's an element of that that is really important. If you go to the next slide, I want to acknowledge what it is that we do know. Go on further. When stress and fear begin, maladaptive coping will kick in. It's something that we talk about frequently in treatment here. And as we look at some statistics, this is actually from some searches done with the Washington Post. They actually reported that an article published by the Kaiser Family Foundation in June showed that nearly half of the people in the United States feel that COVID is harming their mental health. So when we look at increased rates of anxiety and of depression, many times we look at the fact that that leads to increased alcohol consumption and consumption of other chemicals. As you can see on here, alcohol sales rose 55% in literally the first week of COVID, and online alcohol sales are up 243%. There are more people reportedly seeking treatment for alcohol misuse in many different regions, but especially in the regions where COVID actually hit the hardest, according to SAMHSA. And the question is, when people turn towards alcohol to cope, when do we know it's a problem? If you go to the next slide, there are people that are over drinking as a result of isolation, as a result of struggles with really connecting to their purpose in the midst of these times. And the question is, when does it cross that line to be a problem that needs professional help? And we'll talk about that through this hour as we go through. Some of the things that we really want to take a look at is, as you look at these symptoms, they're actually the symptoms of the DSM-5's criteria for substance use disorder. And when we look at making a diagnosis of a substance use disorder, whether it be any type of mood or mind-altering chemical, whether it be alcohol as one of those examples, or even a process addiction, which we'll talk about in a little bit, here are some of the symptoms that we talk about. Using alone. Are we using it to self-medicate? Are we using it in larger amounts or over a longer period of time than had intended? Is there a preoccupation? I just can't stop thinking about it. And a compulsion, I have to do it once I start thinking about it. Tolerance, the need for increased amounts to achieve a desired effect. As we look at some of these symptoms, we acknowledge that addiction is really about trying to put rules in place to manage our intake of chemicals and then breaking those rules or changing them. It's also characterized by the fact that values and behaviors don't match. I value integrity, but I'm one person to you and somebody else to everyone else. I value honesty, but I lie. I value family, but I don't show up to family functions, and I'm not truly present with my children. So really looking at whether or not signs and symptoms are there of problematic drinking is really important. Beyond drinking, as you go to the next slide, when we look at a tale of two cities, there's also very much a tale of two epidemics. There is statistics that show that overdose rates in large cities have risen by 54% in 16 states over the past several months. There's a national laboratory that really looked at the fact that there's a 32% rate of non-prescribed fentanyl in people's urine drug screens and in their laboratory results, and a 20% increase for methamphetamine. And that was just from March through May alone. If you go to the next slide, when we look at increases in suspected overdose rates, if we really think about what's happening in our country, it makes a lot of sense. With our borders changing and being much more shut down than they historically ever have been, there's a lot that's not coming in, not just people and travel, but also drugs. So as we lower the rates of heroin coming into our country, those who are addicted are forced into a position where they're actually using things that are much more potent than heroin, because the reality is dealers need to cut it with something if they don't have enough supply. So we're finding that there are increased rates of overdose as a result of increased fentanyl use being mixed with heroin, which is about 50 times more potent than heroin. So when we look at those lethal alternatives to some of the typical opioids we see, that very much is becoming a part of the picture as well. As we move forward and go to the next slide, one of the things to really look at is the fact that we're not just talking about alcohol and substances. We're looking at the fact that process addictions really surface in greater times of stress. Here at Care and Treatment Centers, we not only treat alcohol addiction and chemical addiction, but we also treat process addictions. So when we look at the impact that COVID has had on gambling and sex addiction and workaholism and spending, and the internet is like a whole nother piece. There's so many process addictions that are really coming to the surface that are making it really challenging for people. If you go to the next slide, as we look at high stress behaviors, we not only talk about the importance of looking at chemical addictions, but we also look at the importance of looking at some of the potential process addictions that can play a role in the midst of our national crisis. The truth is the brain has more than enough chemicals in it to get itself high. When you think about dopamine and serotonin, norepinephrine, oxytocin, and vasopressin, we all have more than enough chemicals for our brains to get high. And that's why things like sex addiction and gambling addiction, they're very, very real and come with some pretty significant consequences. So if you go to the next slide, I want to talk a little bit about some of the things that we have been seeing here in treatment that really coincide with what family members have been seeing. As we really look at some pieces around overeating, so think about those that struggle with an eating disorder. We're either in a position where there's empty shelves or a very full pantry in the midst of COVID. And both of those make it extremely difficult for those who already have pre-existing eating disorders. Not to mention that when you increase isolation and increase the food that we have for stay in place and sheltering, think about the fact that the foods that are good for sheltering are often, quote, fear foods related to those who have eating disorders, because many of them are actually processed foods. So we have been seeing an increase in people who have been struggling with their eating behavior. Online gaming and gambling is another element that has had a lot of significant changes over the past several months. So as we look at the fact that PA casino revenue at this point has actually returned to pre-pandemic rates. So people are getting back out to casinos. They are going back to gambling. But in the midst of that, online gambling actually continues to soar. So when we look at internet gaming and gambling, actually generated over $61 million in revenue in the month of July alone. Now, I want to put that up against, if we put that in context, internet gaming and gambling actually generated less than $4 million this past July. So we're talking about a significant increase when it comes to the way that the internet has impacted that industry. Shopping and spending and working, there's a lot I can say about that. What I will say about work is, for those of you who are working from home, many of us talk about the fact that there's no beginning, middle, or end. It just is. So it's easy to work from the minute we wake up and to continue to be connected to work until the moment we go to sleep, because we don't leave to go to the office. I personally have been really grateful that I've been coming to the office since COVID started, and many people don't have that opportunity and are trying to figure out how to set boundaries with their work and their personal life, which is incredibly challenging. So as we look at some of those pieces, I also want to touch on the significant impact that social media and electronics overall have had on people over the past several months. And with social media, the ever-changing elements related to school and to work, and with the polls and what's happening in politics and all of those elements, it's really hard not to be so connected. So as we talk about how to get spiritually connected, many times that means being disconnected from social media and electronics for periods of time. Pornography, I will say that has significantly increased, and pornography is really having a good pandemic right now. If you go to the next slide, I found this information really interesting. So there's a ton of different pornography sites. I took this information actually from Pornhub. Was feeding my 1-year-old daughter in her high chair while I was researching this. And my husband comes down and wonders why I'm on Pornhub. And I said, I swear it's just for research purposes. But one of the things that we realize is that we look at the significant increase in pornography use in the United States, that on March 17th alone, which is right at the beginning part of the pandemic, the most recent date, which data was actually available for, the traffic of the site for Pornhub was actually up almost 12%. Now, I put this on here because part of what we look at in the field of sex addiction, which is part of my background, is what are people looking at? What are what are the elements that are out there? And what's happening with people is they're actually looking at pornography and COVID together. And that is something that is being researched very frequently. And one of the things that we realize is when it comes to specifically the type of pornography that people are using, there's this curiosity. They want to understand. They want to get more comfortable with what is. So I did find it fascinating that coronavirus themed pornography has been significant in that realm. And we've seen a significant increase in the amount of pornography that is being viewed, both in the United States and what we're seeing in the treatment industry. I want to move along and talk about the mental health, the way that mental health is really taking a toll. These are the things that we know. We know mental health is absolutely taking a toll. About half of the people with a substance use disorder also have a mental health disorder. And in inpatient treatment, it's more like 80% actually. If you go to the next slide, the question is, why are mental health disorders so common? And there's a lot of different factors that go into why mental health disorders are so common for those who struggle with addiction. And when we talk about genetic vulnerabilities, the epigenetic factors and with gene expression, specific genes and chemical use are actually both associated with the onset of mental health disorders. From a neurocognitive perspective, we know that chemicals can really do a number on brain development. So when we look at the fact that there's issues related to impairment of self-regulation, especially when there's issues with self-regulation as someone is developing and growing, when there's issues there, there's a higher comorbidity of the use of chemicals to help kind of self-regulate some of that. From a developmental factor, when I think about adolescence, the use of substances while the brain is still developing and undergoing maturation actually increases the risk of later development of a substance use disorder and co-occurring mental health disorders. So the last piece that I'll talk about in relation to this slide is the whole idea of self-medicating, that when we have a standalone anxiety-related disorder or a depressive disorder, a trauma history, there are many mood and mind altering chemicals that will really, people will use to try to self-regulate some of the symptoms that they're having that they're really uncomfortable with. As we move forward to the next slide, one of the things I want to talk about is this is some information from a survey that was done in June. It was June 24th through June 30th of this year. And overall of there was 5,470 respondents. 41% of them who completed this survey during June reported that they have had an adverse mental or behavioral health condition, and they identify it specifically related to COVID. Related to that, those who reported symptoms of anxiety or depressive disorders, which was about 31%, as well as trauma-related disorders at 26%, they have identified that these issues have gotten worse for them since the onset of COVID. Interestingly enough, as we look at increased substance use to cope with stress or emotions related to COVID, we have about 13% of people who are also identifying that. And that's why we're seeing an increase in the amount of people that we're seeing into inpatient treatment, outpatient treatment related to mental health and addiction. So we know that mental health is taking a toll, and we need to be really careful about the messages that we're taking in. So if you go to the next slide, many of us who are connected to social media, we see this. Social media very much plays a role in the way that we understand what's happening in our country right now. And social media has this way of normalizing problematic drinking and substance use, and it actually has a way of very much reflecting our defense systems as a country. So if you look here, this really looks at the fact that this person is going to increase the amount of alcohol that he's going to be taking in, and focus on me, I'm the six pack here. The joke about quarantinis and what that looks like. If you go to the next slide, for those of us who are trying to homeschool our kids and manage that, big joke about homeschool lessons for fractions today. If you go to the next slide, there's jokes about how much toilet paper, but also jokes about how much wine we all have in our household. So as we look at some of these elements, we're in a position where we have to be really careful about what message we're putting out there to the people that we're helping, what message we're putting in to our own lives. Another thing that we know as you go to the next slide is that social determinants of health create a greater vulnerability. So somebody had asked in a question that I had seen, if you have more significant health issues, does that make you more susceptible to COVID? And as we look at the social determinants of health, according to the CDC, one of the things that they talk about is that people suffering from addiction, they're vastly more vulnerable to COVID, as they're more likely to be homeless, come from a lower socioeconomic background, maybe smokers with lung disease, cardiovascular disease, may be under or uninsured, and may have other serious health issues that are related to drug addiction. So this piece is really important. As we go to the next slide, another thing that we know is that social isolation increases the risk for addiction. And when we look at the fact that the recovery culture is all about really combating the fact that addiction is a disease of isolation, and COVID is also a disease that has created isolation in the way that we are handling it. So in the midst of COVID, it's very much counter to most of the efforts that the recovery community engages in. Addiction really grows in isolation. Another element that we are very much aware of is that our world gets smaller and smaller the worse addiction gets. And as you go to the next slide, we are very much aware of the fact that families are suffering as a result of this. We are seeing much more addiction, much more mental health in our systems. It feels like there are less opportunities to be able to get the help that is needed. And as we talk to each other less and less due to the isolation, there's an incredible belief that other people aren't going through what I'm going through, which is, a message that is in addicted families so frequently. So as you go to the next slide, what I really want to talk about is the fact that COVID-19 and addiction, they are perfect storms for families. Here's what we know. Let's go 2 more slides. As we go through and really look at what is in the media, there are so many factors that play a role in our current setting. There's been a rise in the number of minors that are contacting the National Sexual Assault Hotline to report abuse. That's according to the Rape and Abuse and Incest National Network, which they're the people that actually run the hotline. By the end of March, with much of the country under lockdown, there was actually a 22% increase in monthly calls from younger people under the age of 18. And half of all of those calls, incoming contact, were from minors ages 16 and 17. So as we look at this, there are more calls that are happening for those that are younger. And for many of us, we know that it's not that, the statistics are showing that there's less abuse, but there's also the reality that when we look at who's calling, it's no longer teachers or guidance counselors, because we're not physically seeing children in many schools. It's actually the children themselves that are making calls. There are also reports that the levels of abuse that are seen in hospitals are significant as to what they previously had been. And when we look at that fact, I think that, one of the things that we're seeing is that abuse is getting really bad before people are able to pick up on it. And of those people who actually contacted the hotline in March, 67% identified that their perpetrator was a family member, and 79% identified that they were currently living with that perpetrator. So more abuse, less reports, more severity of abuse is a lot of what it is that we're seeing. And when we look at the next slide and high stress behaviors and roles, we identified before some of the process addictions that can easily come up in the midst of some of this struggle, as well as chemical addiction. But in loved ones and family members, there's ways that we try to fix it. Because we don't know what else to do. I truly believe that when we have mental health and we have addiction in our family, we do the best we can with what we have. I think that is very much a truth. And we can very easily revert back to ways that create a sense of control and comfort, that, we want to protect our kids. We want to protect our spouse's, job and sense of well-being. And it's really hard to challenge addiction while trying to protect all of that at the same time. So as we look at this, one of the things that comes up so frequently is this desire of, can't you just stop? If you go to the next slide, I had a few technical difficulties coming in here. I'm going to leave this on here. I'm watching the questions, and we are going to be able to give you a copy of this PowerPoint. If you go to this YouTube video, it's actually a depiction. We're not going to watch it right now for the sake of time, but it's a depiction that really looks at if we treated addiction like we treated cancer. And it is, in the video, it is a teenage boy who has cancer. It looks like he's been through chemo as he has hair loss, and his mom is yelling at him, "Why can't you just get better? What is wrong with you? Why can't you just get better? What about your grades? You were going to start in football. Just get better. Get up out of that seat and get better." many times we hear that as it relates to addiction, but you would never think about that as it relates to cancer. And it's interesting, I showed this video. We've shown it to our families in the family education program. We've actually shown it to our staff in the midst of clinical supervision. And it gives a different take on really how we look at addiction and the emotions that come up. If you go to the next slide, the reality is that as we look at inadequacy and guilt and anger and hurt that happen in families, it's not just the quote identified patient or the person who's struggling with addiction that's feeling all of these things. The family member very much is too, and they're going through it with exposed nerves. So many times it's really important for us to find the commonality of what we're going through as a family member and what our loved one is also going through, because I can guarantee you that they're going through fear and pain and loneliness, just like we are as family members. So as we go through, and if you go to the next slide, I think it's really important that when we look at prevention and we look at solution, it's important to look at what we need to know. And one of the elements that we really need to know is the fact that there are so many commonalities in what it is that we experience and feel in the midst of everything that's going on in our household. And for those of us in schools and healthcare workers that are going on in our practices as well. As you go to the next slide, one of the things that I think we really, really need to be talking about is the fact that we are not alone. As I talk through this presentation, I could give this presentation to the children of people who are struggling with addiction and mental health, the patients that are, the families that are, the workers here that are, my neighbor. These are things that we're all struggling with in one way or the other. And the other reality is that more people are actually seeking treatment. We've had an increase in admissions in inpatient treatment, and people at first may have a struggle to want to reach out and come into a community setting. But many treatment centers like Karen are doing COVID testing at the door. They're taking temperatures consistently, social distancing, and it's actually created even more of a quaint treatment environment. The other piece that is really important to talk about is that while there's less that's happening in person, there ends up being more accessibility to care, actually, because I found myself referring to patients to online settings where the ability to do an hour-long session over a lunch break virtually is a lot more accessible. Those who live in remote settings have the ability to do group and individual counseling via Zoom. One of the questions that came up before this session was, everything is offered virtually. Does anybody do anything in person anymore? I can tell you that our regional offices in Philadelphia, in Washington, D.C., in Atlanta, and New York, we do some virtual and via Zoom. And the rest we are back to doing in person. So I think a good mix of both, as long as you can do it safely and with social distancing, is really important. If you go to the next slide, I want to talk a little bit about some of the differences between, whether you want to characterize this as unhealthy versus healthy, productive versus unproductive, however you want to characterize it as a professional, however you hear it best as a family member. When we look at how is it that we stage the information to be as helpful as we possibly can be to those that we are supporting. So whether it's that you're a healthcare worker, or if you're working in a school setting, or if this is something that hits really close to home and is a part of your family, some of the things to really think about is, can we take a step back and really be mindful of how is our presentation? Where do we come with care versus control? And I got to tell you, as I mentioned before, I have a 17-year-old. It's so easy to get in the midst of control. My 17-year-old came home after drinking several months ago. And, in that moment, I wanted to ground him and punish him and control him, and acknowledging the fact that, depending on how I decide to react is going to depend on how it is that he is going to respond to me. And can I take a step back and approach it in a way that is invitational, rather than pointing the finger at him. And for anybody who has teenagers, we do that dance all the time. If you go to the next slide, when we look at, again, unhealthy versus healthy, things that are helpful versus not helpful, addiction and mental health put us in a position where, as family systems, we can be very closed and very secretive, right? I don't want you to know how bad my dad's drinking is. I don't want my friends to come in and realize how dysfunctional my household is. And there's shame that goes along with that. There's secrecy that goes along with that. And when we look at some of these elements, my question for you as a family member is if you can relate to, as this characterizes some of the unhealthy pieces, am I in a position to have an open dialogue with my children and my spouse about that, and my parents about that? And if I'm not, where do I find myself getting some professional help to support me in that? Whether it's through the ability to Zoom with a guidance counselor, or the ability to, utilize my insurance to look at some individual therapists, or the ability to look at a full evaluation and assessments. I love the idea that, we're really not human beings, which is really about who we are. In unhealthy family systems, we end up being about human doings. Right? How much we're worth is based on how much money we make, or what our grades are, or whether or not we're the captain of the team, versus who we are at the core. As we go through to the next slide, I think one of the things that I really want to talk about is within our control, what is it that we can focus on? And as a family member and as a healthcare worker, I think it's really important to acknowledge that it's okay to discuss concerns in a non-threatening, compassionate way. How do I hold a mirror up to the behavior and talk about what is it about this that's concerning for me? Also, it's okay to normalize the impact of stress and COVID in where we are as a family system, that there's a lot of people that are struggling with increased alcohol consumption. It's okay to talk about that in an invitational way. It especially works when we describe how we feel and what it is that we want. What do we want out of the relationship with our spouse who's struggling with drinking too much? What do we want out of our family system? How do we have open discussions around being able to hit a reset button? We look at our family and who we are and the goals that we've had pre-COVID, and this is where I see us being now. How do we want to be different? The next slide really talks about empowerment and normalizing the fact that non-drinking can actually be cool. One of the things that I realized, my family is very much into hiking and biking and do a lot of outdoor activities. And I have seen the amount of people that have really taken to that more so than I've ever seen in the midst of COVID. So how do I normalize non-drinking behaviors and activities within my family that fit our value system? Can I hold a mirror up to what the concerns are? Can I give them support to turn down a drink? So if I have somebody in my family who's struggling with drinking too much, how do I really look at the way that I drink, whether or not there's alcohol in my household? Do you have a bar at home? Is that something that you want to replace with, seltzers that are non-alcoholic, and, making smoothies, and the ability to make milkshakes for kids and having parents join in on that? What are some of the tools that we can use to minimize the amount of pressure that there is around alcohol as we move into healthy relationships, as the isolation really starts to dissipate a little bit more and a little bit more? As you go to the next slide, I always go back to family values, really looking at what is it that we value. We do this really cool intervention and treatment here at Karen, where we do a values card sort where we have probably 100 different values and have people really look at what are the values that are very important to them, important and not important, and helping them look at how has addiction gotten in the way of those values. And when you look at moving forward, what are some of the ways that we can really look at realigning our lives to have them fit the values that are important to us? Because remember, addiction is about what I value and what's important to me, and the way I behave. They conflict. They don't align with each other. So recovery, wellness, balance is all about values and behaviors aligning with one another. being able to set really clear and concise boundaries of what is and is not acceptable in your home, and discussing guidelines for your home. So this is where putting the voice to why is really important. I grew up where, you know, we, myself and my brothers, asked a lot of questions as to why, and I felt awful for my mom growing up. But the reality is, when she gave us a really clear explanation as to why, we understood it better. It put context to it. It put us in a position where we can start to think clearer for ourselves. You can also consider designing a plan together. And this is one of those pieces where, if you or your spouse or your children can acknowledge that, yeah, maybe they've been drinking too much, or they have been taking too much pain medication, and they can acknowledge that, how do you put a plan together around starting to make some of those changes? Because at that point, we can start to look at how much of this can we do in-house, which we will tend to tell ourselves we can do more in-house than we actually can, versus when is it that we need to seek professional help. If you go to the next slide, some of the things to really think about when it comes to seeking professional help. When there's a loss of control, I try to set boundaries around my use. I've tried to have a conversation with a family member. I try, and I have a loss of control. I try to control it. I try to put boundaries around it, and it doesn't work. The analogy I give frequently is with the cat in the hat, thing one and thing two. You try so hard to put it back in the box, but no matter what you do, it keeps getting out of the box. That's powerlessness and a loss of control. That's when we need professional help. When I've had attempts to stop and it's failed, and that's okay. It doesn't make me a failure. It just means that this is outside of my control at this point. When I'm in a position when I'm putting myself or others in danger, this is drinking and driving. This is having small children at home and being too intoxicated to be able to care for them. This is you know, operating heavy machinery while we're overly medicated. When it's continuing to impact someone's goals, values, in life, when you look at the ways that it's impacting relationships, and you know, somebody who is unemployed and really wants to go out and be motivated to seek a job and just can't get themselves to do it because they're just drinking too much. When I continue to make promises and I just can't keep them. I promised my son again that I'm going to bring him to the zoo this Saturday, and again, I'm too hungover to do it. I promised my child that I'll help them with homework again. And again, I just want to send them up to my room for them to manage it. When rules are made and I break them, when I try so hard to do it on my own, and if I'm really honest with myself, I just can't. And when we look at this, if you go to the next slide, when we look at the importance of professional help, there's so much out there. It doesn't feel like that. In the midst of COVID and in the midst of isolation, it doesn't feel like there's so much out there. And the reality is, there is. Some of it's remote, some of it's virtual, some of it's in person. It's really important to really look at how is it that you want to seek an evaluation, whether it's a place in your area, if it is an inpatient treatment like Karen, if it's outpatient services or a therapist. Find yourself some comprehensive treatment. So if you're calling an inpatient treatment provider or even a provider for outpatient, I would ask them, what is it that they do to keep people safe from COVID? What about their treatment is comprehensive to be able to really address some of the issues related to mental health, to process addictions because someone's watching too much pornography, because there's significant spending issues. It's important to address all of those elements at the same time. You can also find providers in your network, within your insurance. It's also important to identify that your provider is certified, they're licensed. Treatment centers are certified and licensed and accredited. Our standalone opioid treatment program just went through CARF accreditation 2 days ago. So when you look at that accreditation, that's something that's really important when it comes to where to get help and treatment centers. The last two slides that I want to talk about before we get into some Q&A is I have some pieces here that are just resources, information about Al-Anon, about Nar-Anon. If you're looking for more statistics and information, the National Institute of Mental Health, Substance Abuse and Mental Health Services, they're all really great resources that you can use. If you go to the next slide, if you have questions specific to Karen, specific to our regional offices. Karen has an inpatient treatment setting that I work at that is in Pennsylvania. We also have treatment settings in Florida with Karen Renaissance and Karen Ocean Drive. We also have Encore, which is an outpatient facility in Washington, D.C., a little bit closer to maybe some of the people that are on this webinar. But if you have questions, call. If you're not sure, call. If you need resources with inpatient treatment or in your area, just call. I look at this as the fact that we're all in a storm. We're in different boats, but we are in the storm together. If you go one more slide, just to put this into perspective and kind of come full circle, I think everything is about perspective. And if we look at the ways that we can acknowledge there are elements of this that have helped us to slow down, there are elements of this that have forced us to become more wise, forced us to believe in something if we haven't believed in something earlier. And my choice is to focus on the light and the hope that has come as a result of this pandemic. And the reality is that when we look at the light and the hope that come as a result of getting better from addiction and getting into a life of recovery, it's out there. We're out there, support is out there. And that's why these great people have been willing to put a webinar together for all of you. So it's 12:47, that was my deadline. And I'm gonna stop there and see if there's any questions that I can answer.
Kate, thank you so much. This is super informative. We've been getting things coming through the chat about how helpful this has been, so we really appreciate your time.
Sure.
And I will go ahead and start asking you some of these questions. One that I think will kind of dovetail into what you were just talking about. What are your thoughts about including children in family counseling related to someone's family dealing with substance use issues?
That's a great question. So I think there's a couple of variables that are important to consider. One is the age of the child, and two is the impact that addiction or mental health may have had on the child. So one of the things I know about kids, two things I know about them, maybe three. They're very willful, number one, which is good. Two, they are incredibly resilient. And three, they know much more than we as adults ever think that they do. So I think that there are times when we make the mistake of leaving them out because we tell ourselves that they don't know. The truth is they know. They may not know that it's alcoholism. They may not know that it's drug addiction, but they know that daddy isn't the same. They know that mom is shorter than she normally is. They know that she always has that same cup wherever we are. They know those things. And I think that we need to put the information into context that's age appropriate. One of the examples that I'll give is that we have a 7-year-old of a patient who is here in treatment. His best friend is allergic to peanut butter. He has described to his son that he is allergic to alcohol, much like his friend Tommy is allergic to peanut butter. So I think it just needs to be really age appropriate.
That's great advice. I have another question. I know you touched on this a little bit in your presentation. The question was, is it safe to attend group therapy or family therapy during COVID-19? I'd prefer in person, but have heard that telemedicine is the only option. And maybe you can talk about what some of those safety protocols can be if they're just the normal COVID-19, wear the mask, the social distancing, or if there's anything else.
Yeah, sure. So not everything is done virtually. I think that there's a lot of outpatient places that are looking to do some more that is in person. I think we have a lot of great virtual options, and sometimes people are they want to see people. I'm one of those people, so I completely understand it. When you look at social distancing, it's obviously 6 feet apart with masks, which makes it interesting to have group when you can only see half of someone's face. Temperatures are something that is really, really important. Acknowledging the importance of having, we may get so sick of answering the questions, but there's certain questions that are cornerstones as it relates to COVID, related to travel and symptoms and all of that. But yes, it's safe to do it in person with the right parameters that are in place that many healthcare workers have been given.
Great, thank you.
Sure.
I have a question that's a little bit specific. So if you can comment, great. If not, then maybe you can direct them to a resource to get the answer for this. This person had a family member that was clean after being on, oh, they were addicted to pain pills, and then they used Suboxone to be clean. They had a relapse, and what he thought was heroin was actually fentanyl. He's now in a methadone program, but he continues to relapse. Do you find that it's much harder to get off fentanyl? Kate, did we lose you? All right, we'll give Kate another minute to see if she can get back on here. Thank you all for your patience. All right, I think that we have lost her, unfortunately. Luckily, she was able to get through her wonderful presentation. We will be sending this presentation out along with the links to all of the recordings at the conclusion of the entire webinar series. For more information on the remaining webinars that we have, or for resources on substance abuse and addiction, please visit actonaddictionnow.org. We're also going to put that link in the chat for you all. Our next webinar is going to be on Monday, September 21st at 6 p.m. and it's talking to kids about race and racism, promoting positive socio-emotional development, and that'll be with Dr. Joseph Williams. We would also be very appreciative if you all could take our survey. The link is being put in the chat for you all, so you can take it at the conclusion of the webinar. This will help us evaluate our sessions for this year and provide vital information to shape next year's conference, whether virtual or in person. I want to put a big thank you out there again to Kate, and thank you all so much for joining us today, and we hope to see you at the next webinar.